Welcome to SLP Nerdcast, your favorite professional resource for evidence-based practice in speech-language pathology. I'm Kate Grandbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. A link for membership is in the show notes.
Hello, everyone. Welcome to SLP Nerdcast. I am so excited for today's episode. I am here with a repeat guest who has been on the podcast before to teach us so many things about linguistic ideology. I am joined today by Dr. Chelsea Prevett, who is here to talk to us about models of disability. Welcome, Chelsea.
Thank you so much. I'm so happy to be here.
So before we get started, for those, for people in our audience who haven't heard some of your other work, can you start by telling us a little bit about yourself?
Yes, I am an assistant professor at the University of Texas at Austin. And my work is really about improving the experiences of marginalized communities who are receiving services in speech, language, and hearing. And I focus on educational settings, particularly in early childhood education. And so I kind of paint that broad picture because for me, that includes a lot of things from how we are including these concepts in the curriculum to how we are assessing young children who have marginalized linguistic and cultural backgrounds to storytelling and working with teachers. And so all of the things.
I'm so looking forward to this conversation. Every time I talk to you, I learn so much. And one of the things I love about your work, actually, before we hit the record button, I kind of fangirled over you for a hot minute about your writing because it's so good. And you bring so much really needed perspective to our field. So I'm very much looking forward to today's conversation, as I'm sure everyone who is listening is. Before we get started, I do need to read our learning objectives aloud. So I will get through that as quickly as I can. Learning objective number 1, describe the differences between the medical, social, and critical or radical models of disability. Learning objective number 2, describe the difference between impairment and disability. And learning objective number 3, describe Black disability politics and how this impacts the work of speech language pathologists. For anyone listening who is interested in using this episode for ASHA CEUs, you will be expected to demonstrate learning knowledge gains related to these 3 learning objectives in our post-test. You can find the link to the post-test in the show notes. For anyone who is interested in learning more about the financial and non-financial disclosures or any course disclosures related to myself, the course, or Chelsea, all of that information is listed on our website, and you can follow the link in the show notes to the website to learn more. All right, administrative stuff out of the way. Before we get started and really talk about this paper, so today's conversation is rooted in a paper that you published recently. I think it came out, we're recording this October 2025. I think it came out in the last couple of months.
Yeah.
And I think this paper is as we discussed before we hit the record button, it's very complex. These topics are really, really important. And with anything in life that's really important, it requires a lot of attention and focus and digestion. Before we kind of get into that complexity, I wonder if you could tell us a little bit about just what are models of disability? What is the landscape that we are about to embark upon with you?
Yeah, so generally speaking, a model of disability is a there are different frameworks for understanding disability, understanding the experience of disability, um, that each kind of takes a different perspective or has a different focus or a different lens. And I want to read a quote. There's a book that I highly recommend called Disability Politics and Theory by A.J. Withers. And they say that there are so many models for inventing and understanding disability because disability is not a fixed category. Rather, it is a fluid definition that depends not only on the context in which it is defined, but also who defines it. The models of disability, however, do not have fixed borders. Rather, they can be porous, bleeding into each other, or reinforcing one another. And I start with that quote because we tend to, I see this a lot in our field, we tend to jump from trend to trend as different like buzzwords come out. And it keeps us sometimes from thinking holistically and comprehensively about people's agency and dignity. So for each of these models, we'll talk about critique, but we can critique and we can also take what's helpful, because the very nature of disability is that it is fluid and nuanced. And so our models have to be too. And using the medical model as an example, many of us have heard / believe that the medical model is problematic because of the ways that it attaches value to an individual's level of functioning. And there are those of us who benefit from medical intervention to not be in pain or not be chronically fatigued or any other state that doesn't allow us to be our full selves. So if we reject the medical model wholesale, we end up demonizing people who seek medical intervention for their disability as they navigate not just the physical implications of their disability, but the social discrimination as well. And while I would love to see a world where no one feels the need to mask their autism or their stutter or their limp or whatever it is just to avoid the consequences of other people's ignorance, we're not there. And so people have the right to exercise their agency in how they manage that. So a lot of our conversation will focus on the social model today, but as I'm critiquing the model, I'm surely not saying let's abandon it because the model has brought us some important things like accessibility, like policy change. And so we need those things to get to where I hope to see us go, and we need more.
One of the things I love about what you just said was the fluidity and nuance of this topic. I think as a professional myself and a student, always learning, it feels nice and cozy to put things in boxes as we learn new terms, especially, as clinicians when we're faced with clinical decision making or, we're faced with tasks at our job. Compartmentalizing is an efficient way of thinking. And you can't really compartmentalize a human being's experience. So
Mhm.
the idea of these models not having fixed boundaries, but being fluid and influencing each other is a perspective I had not thought of, and it fits perfectly. I just love that. I wonder if you could. So you've talked to us a little bit about the medical model, which is pervasive in speech pathology. What is the social model?
Yeah, so the social model was developed by disability advocates, particularly those in the UK, in response to the medical model, which, as I've mentioned, positions disability as an individual problem and that all disabilities need to be cured. So, what the social model did was kind of flip that around to say that individuals aren't inherently disabled, they are disabled by their environment. So the intervention of the social model then is on society rather than on the individual, with the goal of making a world where everyone has what they need at a baseline and that no one is discriminated against because of their perceived limitations. So this framing highlights how fluid disability is, because a person can be disabled in one context, but not in another. For example, a student with an oral language disability is disabled in a classroom where there are no visual supports, or the teacher speaks quickly without pausing, or they don't have access to assistive technology. But that same student has no difficulty communicating with peers or family or community members, or even other teachers and professionals in their school where everyone is communicating multimodally. And so this experience of becoming disabled in certain spaces is compounded for those with other marginalized identities. In the context of the paper, we're going to be talking about Black AAE speaking children, where their language, by nature of their being Black, is perceived as deficient or in need of remediation. And I think that most people can identify the problem with counting dialect as disorder, as we like to say. But um, with that, in my observation, comes either a resignation or an anxiety over what Black AAE speaking children can achieve. And I believe that it's because we as professionals lack what Jamila Lay Scott calls institutional literacy, um, which is the ability to read how white supremacy is enacted at the institutional level. And so, yes, that includes standardized assessments, which are mainstays in educational institutions, but it's also in all of our practices, in the way that we are trained, even in the way that we think about language, which we'll get more into later. But it's the things that we take for granted as being evidence-based or objective or meritorious that we have to interrogate.
I love the term institutional literacy. Was that the term?
Yes.
Institutional literacy. That's a great, great term. And I'm looking at our first learning objective, and I know that we need to we're going to be discussing critical and radical models of disability, but I wonder if the best way to get into that is to ask about your criticisms of the social
Mhm.
models of disability. Um, can you elaborate on that a little bit, especially through the lens of affirming Black disabled children's experiences?
Yes. So, first, I want to say that plenty of scholars and activists have critiqued the social model. So, I'm not the first person to do this. I want to be
You're not
clear
setting
about
anything on fire over there today.
that.
Maybe just a little bit,
It
but
might be new to talk about it in the context of language development, but the actual critiques of the social model, I I did not come up with that on my own. Um, so there are kind of three major critiques that I want to talk about. And the first one is that the social model can sometimes only morph the oppression of disabled people rather than dismantling it, because we get the language of special needs or access needs or accommodations, which are read by some people as special treatment that is undeserved, or as an indication that an individual is inept in some way. And the education that sometimes happens in response to that ends up reinforcing ableist norms. So rather than centering the dignity and the value of all body minds, the message that often gets across is, I have this thing that's different, but I can still do X, Y, and Z. I can still do the same things as you. I can still approximate normal. And Stella Young calls this inspiration porn. So these are the stories of overcoming disability rather than living with disability. The second critique is of how the rights-based approach dominates US-based strategies for meeting social model goals. And by rights-based approach, I mean legislation, kind of the policy change approach, the legal aspect of securing rights, securing access. And this becomes problematic for Black, Indigenous, and other people of color who are still systematically denied their rights. And as Audre Lorde says, there's no such thing as a single issue struggle because we do not live single issue lives. And so with rights-based approaches, not just with disability advocacy, but in other movements as well, the focus is often on one issue. And when you focus on one issue, people with other marginalized identities continue to be marginalized even within the movement. And that kind of ties into the third critique, which is that the social model separates the notion from disability from impairment. And it does this in order to name the oppression experienced by disabled people not as being the result of their individual limitation or diagnosis, quote unquote, but as a result of the inaccessibility and the ableist ideologies that permeate society more broadly. And so that the motivation is good, right, to name that oppression, but by separating the two, disability becomes disembodied. But we're not separate from our bodies, of course. So others' perception of our disability can't be either. And Black people in particular are hyper visible in terms of how our bodies, behaviors, beliefs are constructed as deviant. And so mainstream, AKA white stream, conceptualizations of disability that don't confront other systems of oppression allows for the continued pathologization of Blackness itself. So it creates hierarchies within disability where Black people are still othered, whether it's for the way their disability is perceived within our communities, how their disability manifests within our particular cultural context, or in how much more frequently Black people are being labeled as disabled. So the body continues to be important for Black disability scholars and activists.
I want to ask a question related to how what implications this has for speech pathologists in schools. But before I get to that, you did just touch on something else we wanted to talk about today, and I wonder if now is a good time to address it. Just that the difference between impairment and disability within the context of these many facets of human lived experience and intersectionality.
Yeah, so the term impairment is connected more with the individual, with the body, with functioning that is often couched in that medicalized language. And again, it's not to say that that language shouldn't exist, right? It's important to name the things that cause us pain, right? Disability With disability, the focus is more on the social implications of the individual aspects of that experience. Um, and for some people, the term is used interchangeably. For some disabled people, it's used interchangeably, and for others, it's not. But kind of the root of where that difference came from is rooted in the social model, in terms of separating, making a distinction between disability as an individualized experience versus as an experience within one's broader context.
Thank you for delineating those two things, because I have a feeling that's going to, the difference between those two concepts is going to end up permeating into my next question, which is
Mm-hmm.
really about how we as professionals are experiencing this when we are working in schools within these systems that are rooted in the
Mm-hmm.
medical model in a lot of ways. Thinking about the children on our caseload who are coming to us with their own individual human experience with intersectionality, and what implications all of these concepts have for us as working professionals.
Yeah, what I've seen happening in the literature within our profession is kind of replacing the word impairment or disorder with disability, without engaging the larger implications of that. And so even as we're using the word disability, the overwhelming model for services is at the individual level. Um, but if we really consider what the social model might look like, um, in our services, then it involves a lot more of the context rather than the individual. A lot more of intervening on classrooms, intervening on the adults in the situation rather than on the kids that are receiving our quote unquote direct services.
I'm going to try so hard to not get on my nerd soapbox, because you've just like poked into my area of interest, which is context, because we as individuals, you know, we work within systems, we work within organizations,
Mhm.
we work within businesses. Those businesses have policies, those businesses have leaders, those leaders are people. Sometimes those people are nice people,
Mhm.
sometimes they're not nice people. We work within these complex fabrics, and the idea that, individual service is just that individual service is misleading, because we are so continually influenced by the culture and context of our organizations. That was my tiny little soapbox. I'm done.
I love it.
I'm done. I'm done. But I wonder if maybe now that we've kind of worked through the basic terminology for models of disability, and talked a little bit about how this influences us as professionals. I wonder if we could start talking a little bit more about your paper, and
Mhm.
specifically Black disability politics. Can you,
Mhm.
again, before we get into it, can you tell us what that is? Can you define that term for us?
Absolutely. So, a Black disability political approach is part of a larger body of work in Black disability studies. So, I'll refer to multiple scholars here in our discussion, but Black disability politics specifically was developed by Sammy Schalk. Um, and it's a framework that describes how Black people, disabled or not, engage disability through the lens of white supremacy in our pursuit of liberation and justice. So it is community oriented, it's concerned with how disability functions as an ideology and as a system of oppression over who is or isn't disabled. Um, so within a rights-based model, disability has become a privilege that Black people and other multiply marginalized people often don't have access to. And so the point is to um, identify how ableism impacts us all and to create structures of care that attend to the well-being of everyone, regardless of what their disability status is or isn't. So as a radical model of disability, it recognizes that as the system continues to construct and reconstruct disability, it does so on people's bodies. And that construction is part of a larger narrative about who is capable of what. And who is capable of what is constructed around race, gender, sexuality, language, and all of the other social categories we're organized into. So in defining disability, it's important to name both what the system has done to us in addition to how the system responds to us. Dennis Tyler says that a historical view of disability includes both the condition of an individual and the restrictions of a system. So disability isn't just socially constructed, but it's institutionally imposed onto marginalized people as a whole in both ideological and literal ways. So not only does racism as a systemic issue influence people's beliefs about Black people, the system also exerts actual violence, psychological and physical violence on racially marginalized people in ways that cause disability. And that violence is so regular, right? It's so mundane that it's naturalized in the way that the occurrence of disability in marginalized communities it's expected. And on this point, I draw heavily from Jasper Puar. Her book is called The Right to Maim. And she says that disability in racially and ethnically marginalized communities is unexceptional and remains marginalized even within dominant disability discourse, because those stories, the stories of disability in Black communities, don't fit into the respectability politics and the empowerment models that shape mainstream narratives.
So can you elaborate on how the framework that you just described shapes how we as clinicians think about communication and disability and the intersection there?
Yeah, when it comes to communication, I think this approach helps us to think beyond labels and to pay attention to how we all language in ways that are specific to our unique body mind. And so, what matters more than the specific forms we use is the way we establish and maintain and manage and negotiate meaning with our communication partners. So, it's really about relationship and it's about agency. And I think that is where it really offers a way of extending what the social model kind of started in terms of not neglecting the political implications of the bodies that our students live in.
So in the paper, you also discuss crip languaging and Black languaging practices, two terms that, just in case our audience is not familiar with them, can you describe what those are?
Yeah, both Black languaging and crip languaging honor the body mind of the language. So in this case, Black AAE speaking children with a communication disability. So Black languaging refers to the communication practices that are rooted in historical and cultural realities of Black people. And me and Karina Seychow have a paper about that. We also have a SLP Nerdcast episode about that.
Yes, that is out. We will link that in the show notes for anyone who wants to listen to that.
Yes, and so it's a way of naming that history and um, the the identity that is bound up in the way that we use language. Um, and so I add crip languaging to this paper to center what Suresh Kanagaraja calls crip knowledge. Um, he writes about how language research across fields, not just in speech language pathology, centers normative linguistic codes as a way to understand human communication. But he explains that if we all language and we all employ diverse strategies for making our communication effective, then we need to consider all languaging to truly understand it. And to do that, we have to tap into what he calls crip knowledge. And he says that requires a relational ethics where effective communication relies on mutual support rather than individual responsibility. And I also draw here heavily from John Henner and Octavian Robinson's Crip Linguistics Manifesto. And they explain that cripping language puts the people back in languaging because it honors the work that people put into languaging, especially via disabled bodies. Um, so when we assume that we all have the capacity to make meaning, it changes the nature of our work, which is really why I wrote this paper, to tell a different story about Black children who participated in my dissertation research. So the analysis this time around looks radically different from the original.
I think I said this during our episode with Karina, how much I love languaging as a verb and how much that incorporates in terms of human experience, in terms of connection. And I'm thinking a little bit about how we as professionals, as we're writing our goals and we're working with our students, um, working on quote unquote effective communication and what quote unquote effective communication looks like, and how so often that in a goal or in an objective or in paperwork is sterile, right? It's form function and class. I wonder if you could elaborate a little bit on how all of these concepts of crip languaging and Black languaging impact these traditional ideas of quote effective communication.
Yeah, it completely flips it on its head, really, because instead of starting with normative communication practices, normative being defined by that bell curve that we get in standardized assessments, which is a concept that came out of eugenics. So let's make that clear. But instead of starting with the normative, instead of starting with the center of the curve, it starts with the left tail and says, this, we as humans communicate. And when left to communicate freely, we are effective in our communication. And so what does crip languaging tell us about human communication? Right? That's where we get to like the real meat of what human communication is.
I wonder how, I'm like, again, all of these concepts are deep and complex. Um, and I know we have a study to get to. I know, you've already mentioned your data. You've already mentioned your, how this kind of grew out of your dissertation. And I'm tempted to ask so many more questions about these very big ideas that you've just shared. I'm going to stay focused. I'm going to stay on task. I think if anyone, we're going to list a lot of references in the show notes. So if anyone is listening and wants to learn more about crip languaging or some of these really big concepts that we've talked about, we will definitely list some additional reading in the show notes. And of course, if anyone's listening and would like to write in with questions, we're happy to triage those questions as best we can. But I do want to, we only have about a half hour left. I want to ask you about this study and kind of unpack the intention of this paper. You looked at 2 case studies of Black disabled AAE speaking preschoolers. You used a qualitative analysis, and I wonder if you could tell us a little bit about how you positioned yourself to rediscover this data.
Yes, I love this question. Um, I do, because most of us are taught that good research doesn't involve the researcher, but that's impossible. And critical scholars are clear on that there is no neutral. And my decision to use a qualitative analysis is not at all neutral. And I explicitly say that in the paper. And I think that's important. The reason the reason I wrote this paper is because I didn't like the analysis that I did for my dissertation. So, so for my dissertation, I looked at the use of Black language features by monolingual AAE speaking children and their Spanish speaking peers. So in that paper, I focused on the bilingual children because my research aims were to describe how Spanish speaking preschoolers acquire AAE from their monolingual peers, to map out a way of distinguishing those who had typical or normative language development from those who did not. And I'm going to leave out a lot of juicy details, but I was dealing with a dissertation committee that was asking me to copy the methods of a white researcher who is not a speaker of AAE. And long story short, I changed my committee. But by that time, I had what I had, and I was trying to save it for the published article, which was very difficult to do because ultimately some things just couldn't be reconciled. But I published that paper. There's some useful stuff in there. But after that, I really sat with the kinds of comments and questions that I got from my first committee and decided that if those are the kinds of responses that I get from this study, then I must be asking the wrong kinds of questions. So I really took time to delve into research rooted in critical theories across fields, to re-educate myself, publishing my learning as I went, and then I returned to the data with a more radical lens. And one of the changes that I made when I first started the original study that I'm proud of, despite my committee's objections, I changed the protocol, the assessment protocol, because originally I was supposed to do a picture description task. And that decision was based on previous research. But I had done all of these classroom observations in the preschool program I was working with. I even led circle time a few times before I started collecting data. And I realized that that task wasn't capturing the language I was hearing in the classroom. And so that's why I switched to doing the play samples. But when I got to the finished product, the published paper, you still couldn't see that. You still couldn't see the richness of their communication. It didn't reflect the reality of the children's languaging. And Gloria Latson-Billings, who was the Black education scholar who, do I need to pause?
No, I have a question. I have a
Yeah.
question. I didn't want to rudely interrupt you, but I did anyway. I'm so sorry. I want to
It's okay.
know how did you know? What process was happening in your mind to say, in your gut to say, this is not capturing their real experience of languaging? What was it that was sticking out to you that you hadn't captured? Like, what was that nagging? Like, if you spent all of this time re-educating to go and revisit the same data set, I imagine that that was a nagging gut instinct.
Mm-hmm.
What was it that you wanted to capture?
that when I think of that classroom, I didn't see disabled children. But that's what you would think if you read the original paper.
Interesting.
It's grouping the children, it's separating the children based on their language ability, but that grouping isn't visible in the classroom that they were in. And that was part of it too. Like it was a classroom led by Black women who were allowing them to language freely. So they were doing it right. And I wanted to tell that story. And I often go back to something Gloria Ladson-Billings writes. She's the Black education scholar who developed the framework for culturally responsive pedagogy. And she said the bravest thing she ever did was to ask a different question. So she said, instead of asking what's wrong with our children, I decided to ask what was right. And so that's what I wanted to do with the data is to highlight what is right. And so that was my new starting place.
No one can see me smiling from ear to ear. I think that's such a great quote and something that's so applicable, and it's a great story. I'm happy to now stay on track. I'm sorry that I sidetracked us with that
No, that's
question.
great.
It's relevant because
Mhm.
in this study you were a participant and a researcher. What was that like? How did that wearing two hats impact how you moved through all of this? I assume it's related to that concept of
Yeah.
telling the truth or your experience.
Well, the data was collected like, back before I had all of these critical frameworks. So I definitely entered the space as a clinician with the goal of capturing as much oral language as I could. And because of the context, well, really, there were two. Some of the kids were recorded at school with another peer, and for others, because it was during the height of COVID, it happened with in the home. So I did some home visits and invited the caregivers to participate. So I wanted to be as invisible as possible. That was my intention going in, but that didn't happen. The kids were excited to play with me, and I wasn't going to ignore that. And I was excited to play with them too. But especially with the home visits, because the parents expected me to do the playing, even after I invited them in. So I did. And oftentimes with parents, they want to get their kids to show you what they can do. And so in those instances, I saw my role as really keeping it play rather than an interrogation.
Which so much of what we are taught to do in training programs is this kind of I don't want to say interrogation style, but very authoritarian, very adult led.
Mhm.
So I love that description. What did you find in this study? Very open-ended question there.
Oh, yes, that is a
Not an accident.
um so what I found the second time.
Yes, the second time.
What I found the second time was these just beautiful interactions um, that I frankly I think I could see because I am also a part of that community. By the way, I was doing this research in the city where I grew up. And so when I say my community, I mean my my community. Um, and so um, I that was part of my lens too. Even though I was coming in kind of with a clinical hat on, I was also like very much felt at home in a way that I don't in other places doing research. And so um, I, I saw that, and I kind of went searching for some methods in linguistics that would help me describe um, the relational aspect. And so I ended up focusing on repair and negotiation as strategies for meaning making. So this was a lot of new learning for me in terms of learning what that is and how it's conceptualized in research. Um, but I kind of did what I always do and looked across fields to see um, how I could bring things together to tell the story in a way that felt good, in a way that felt true to their experience, the experiences of the participants and my experience with them.
And what did you find about meaning making and
Yeah,
negotiation?
sorry. Sorry. I felt like I was talking a lot. I was
No,
like, let me
no. It's great. No, it's great. I'm just so curious now.
Yeah, so I found what the literature on that says is that it's what we all do. And my goal in focusing on these strategies was not to just, part of it was normalizing those strategies, but also to say that we should expect this because repair and negotiation are a part of communication across cultures, across contexts. So, in a very real sense, those strategies, that is human communication. Um, and it's so ubiquitous, we often don't even notice it. But when you're trained like we are to find what someone is doing wrong, it becomes a concern. And so I wanted to reframe those strategies as opportunities to affirm what children are doing in their interactions to meet their communicative goals and to further engage their communication partners. Um, to notice a breakdown and request a clarification or respond to a clarification, to use all of your resources to respond to a request for a clarification, whether that resource is something in the environment or another person, to repeat what someone says as a way to affirm or reject their input. All of this is how we do language. And this is how learning happens. And so it's a plus regardless of who is using these strategies. And these are strategies we teach usually in the context of social skills with kids who have quote unquote difficulties with pragmatics. Um, but that's what all effective communication comes down to. It's, it's all pragmatics, it's all social interaction.
Which brings me to my next question, which is related to one of the things you describe in the paper, seeing things like argument and humor as
Mm-hmm.
big pieces of communication repair. I mean,
Mm-hmm.
what's more human than arguing and using humor, right? I mean, that to me that just
Yeah.
shows is a reflection of the connection.
Mm-hmm. This was the funnest part of the data to me. This was the pleasant surprise, I think, that came out of this data with this new lens. Um, And there's a long argument that I put in the paper between Kareem and Robert. And it's like my favorite thing, like in all of the play samples that I collected for my dissertation. And so I was so happy to be able to talk about this. But to answer your question, with argument and humor, it was important for me to talk about this too, not just because it's fun, but because sometimes what we do in therapy actually restrains children's communication um, in ways that we end up policing their creativity and their agency. We tell them that certain things aren't appropriate, that arguing isn't nice, or that learning isn't time for humor. But these things just aren't true. Can they turn rude or inappropriate? Sure. But they aren't fundamentally inappropriate or a hindrance to learning. Um, so these are strategies that not only maintain a particular relationship with communication partners, but also between the child and what they're learning. And sometimes the mode of the argument or humor is culturally specific and might even be an expectation in that child's community. So we shouldn't impede their development in learning those strategies because they're necessary.
I love that. And I think that what you just said about us policing children is another reflection of some of these models we talked about earlier that are very driven by our judgment and driven by that,
Mm-hmm.
kind of sense of power imbalance where we have the power and someone else doesn't. No, well, clinicians or people in positions of leadership, hold
Mm-hmm.
the power, and those power imbalances that are inherent in a therapeutic, medical model setting. I wonder in our last couple of minutes if you could talk to us a little bit about the clinical implications of this
Mm-hmm.
study in terms of our, goals of therapy. We've talked about this a little bit, but this has a pretty far-reaching implications.
Yeah, so intervention tends to be transactional. And as you mentioned, centers the goals of the clinician at the expense of the goals and the agency of the child. And as clinicians, our goals tend to align with the institutions, which is to assimilate children into normative ways of being. And I think too often the goals for therapy are written from questions on standardized assessments or from curricular standards, which center normative communication practices. So the overarching goal tends to be to make children not have a communication disability, or at least appear not to as much as possible. But if we make therapy relational rather than transactional, then decontextualized assessments become much less relevant. And what's more relevant is the interaction beyond any test. And when we observe what children are doing with their communication with a relational ethic, they tell us what they need. If we pay attention and allow them space to communicate freely, they tell us how to expand on the strategies they're already using. They tell us how they're engaging with curricular content. And that opens the door to more direct conversations about the goals they would benefit from. In one of my papers, in the critical praxis paper, I talk about letting students talk back to the materials, because this is where we get at the how and the why of their engagement. And so centering connection and co-construction requires us to be co-learners with the children we're serving, which means we have to listen more and not just with our ears. And we can teach others in the child's environment to do the same, to build that reciprocity across contexts.
We don't have time for me to go down another rabbit hole, but I just want to highlight for 1 second the implications of one sentence that you just said, which was the
Mhm,
limitation of standardized tests, the limitation
mhm,
of our traditional evaluation paradigm. Because so many of our systems, eligibility, right, access to service, reimbursement for services given, so much of that is built on these status quo concepts of evaluation. So what you're
mhm,
saying is a true systems shift and has really
Mm-hmm.
big implications for our field, for organizations, and for industries. Is that an overstep, or do you agree?
It's an overstep. Wait, was what an
Do
overstep?
you do you do you agree, or is that an
The,
overstatement?
no, absolutely not. Like, it's not an overstatement.
I wanted to make sure I was on the right wavelength,
Yeah.
because it leads into, another kind of clinical takeaway. If we're talking about our industry and we're talking about organizations within industries, right? If you think about it from like a
Mm-hmm.
national level with law and policy, and then field specific norms and standards set by state
Mm-hmm.
regulations and ASHA, and then one layer down, the organization that you work in, the hospital, the school, the
Mm-hmm.
district, right? It gets smaller and smaller in this kind of funnel sort of triangle.
Mm-hmm.
When we get put into this pipeline of our profession, we enter this profession through schools, through graduate schools, through
Mm-hmm.
training
Mm-hmm.
programs. And I'm just thinking about how all of these systems are very interconnected. You
Mm-hmm.
also used a word earlier I loved, which was permeates. So how our culture, these, ableist practices, racist practices kind of permeate through all of these layers, triangles, funnels, whatever shapes you're imagining in your mind.
Mm-hmm.
And I wonder if you could just talk very quickly about um, what, anybody who's listening who's teaching in a training program, or is in a
Mm-hmm.
training program, or is a new grad, or is a student, or supervising new grads, how these kind of anti-ableist and anti-racist frameworks can have a place in training
Mm-hmm.
programs.
We're asking this all the time, and my response to this question is also a response to the fact that we talk too much among ourselves. So my first recommendation is read widely, because our field is really good at staying siloed, and it's a problem. Most most graduates, they come out of their program only with a clinical understanding of language. And we call ourselves language experts or communication specialists or whatever, but it's mostly not true. Like, we're trained to be specialists in pathology without having a robust understanding of communication to begin with. And so anytime we see or hear something that's not in line with what we've been taught about normative, monolingual, white mainstream English, we don't know what to do with it. And so that's the first thing. And the other thing I want to return to is this idea of institutional literacy. And actually, there are four eyes to this framework that Jamila Leigh Scott talks about in her book, Black Appetite, White Food. Institutional literacy, interpersonal literacy, ideological, and internalized. So all of the ways that oppression shows up in our work and in ourselves, um, because you can't do anything about oppressive structures if you can't recognize them. So um, we need that, because racism and ableism are systemic issues that affect every single one of us, and so we need to understand our part in that.
I appreciate this conversation so much, and I know that we have covered a tremendous amount of ground in this conversation. And as I already mentioned, we will list many references in the show notes for people to further their learning, further their reading, and start to unpack some of these very dense, complex ideas. My last question for you is just about how you experienced writing this paper and this idea of the tension between the reality of our field and the realities of institutional research and the power that you've put into this paper.
Um, yeah, so for me, it all comes back to story. As I've been writing my last couple of papers, there's a quote by S.R. Tolliver where she says, "Storytelling is not a luxury for Black people. It is vital to our very existence. But researchers are often restricted to gathering stories and not telling them." And what I have learned, even in outside of my work and telling my life story, there's a difference between telling your story and explaining your story. And that difference has a lot to do with what Toni Morrison calls the white gaze. And so my goal has been to stop explaining the stories I wanted to tell with the language that the white academy taught me, and to start telling the stories in my own language and the language of the communities I was working with. And including their voices directly as much as possible. And that's what I encourage others in the field too, who are either new to the field or shifting perspectives in the field, because we don't have to prove anything. I feel like so long we've been taught that we have to prove that our language is a language or that our culture is good, but there's no proving, and there's a wealth of literature to stand on. Scholars of color, again, mostly outside of our field. So it's been really important for me to find the scholars, living and past, who speak to me, who like brighten my flame, what I call the great cloud of witnesses in my scholarly community, and even including those who are writing from outside of the academy. And so it's venturing out and finding your people.
Was wonderful words of advice. And I just so appreciate you coming on and sharing all of that. For anyone listening who would like to read this paper or any of the other references that we've mentioned, we will link the reference in the show notes. Thank you so much for being here. I also want to thank the rest of our production team who makes this podcast possible. Dr. Anna Palamumi, who's our CE administrator, Tegan Ahern, our production manager, Darren Lopez, our production assistant, Tracy Callahan, and Dr. Mary Beth Schmidt, who help to elevate our peer review process. And last but not least, Chelsea, thank you so much for being here. I knew I was going to learn a ton from you today. I always do. And I'm just so grateful for your time. Thank you so much.
Thank you. Thank you for having me.
Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.